Great. So today's session, titled Driving Quality and Advancing Healthcare Access at the Pharmacy, is brought to us by Express Scripts by Evernorth. Express Scripts by Evernorth has been a longtime partner and supporter of both MHPA and our health plan members. I want to thank the entire Express Scripts team for pulling together today's session and sharing their great knowledge. With that, I will go ahead and toss things over to Ashley Holsworth-Nash for introductions and today's content.
Thank you so much, Eric, and thank you everyone for joining us today. We are really excited to talk through how we view quality at the point of care, the point of sale with our pharmacists and our pharmacy providers. I'm going to spend a few minutes in the beginning just really level setting on our strategy and how we view the pharmacist having a greater hand in the quality of members' care as we move forward. But I want to stop and give a brief background and some introduction for myself and for those that you will hear presenting today. So like Eric said, I am Ashley Holsworth-Nash. I have been with Express Scripts for about 10 years, spending the majority of that time actually on the client side in account management. I'm a pharmacist by trade, and most recently, I am part of our supply chain team, which is where we have our product area. So I am focused on our retail product offerings and our strategy and solutions to really drive our products into the marketplace that allow us to have the quality of care with our pharmacists and our pharmacies. Stephanie, would you like to introduce yourself?
Sure. Hello, everybody. I'm thrilled to be here talking with you today. I'm Stephanie Smith-Cooney, and I am a pharmacist. I'm about a year and a half into my role at Express Scripts, where I'm the Senior Director of Independent Pharmacy Affairs, which is a completely new role that Express Scripts created, and that has been really exciting to be part of. I'm going to tell you a little bit more about all of the work that I'm leading in a few slides from now, but I'm thrilled to be here and really excited to talk to you today.
Hi, my name is
Adrian.
My name's Adrian Muralidharan. I'm a clinical program director here at Express Scripts of our MoreThanRx services. And I've been with Express Scripts for more than 15 years, most of it spent within the regulated market space. I kind of grew up in Medicare Part D and shifted over to Medicaid as well. I've expanded to managing prescriptive authority and now into our MoreThanRx services and, figuring out how we can provide patients with better access to care at the point of sale. And I also am really excited to be here today and to tell you more about our services. And I'll pass it back to you, Ashley.
Fantastic. Thank you all. All right, well, let's just dive right on in. So Allison, if we want to go to the first slide here. We really want to anchor ourselves today on why we are focusing on quality at the pharmacy. So we know there are challenges. I'm sure every single one of you are feeling the reimbursement challenges in the Medicaid space. We know the dollar has to go further, covering our patients, ensuring that they have access to the right medications, the right quality services, and being able to drive their outcomes is not getting easier. We know the reimbursement pressure is getting more and more challenging from the state agencies. And we know we've seen that leads to pharmacy pressure. We're seeing in the media, I'm sure you can turn on any outlet and hear about the pharmacies at this juncture, talking through how it's harder to sustain a pharmacy, how it's harder to keep an independent pharmacy open. The financial crunch that the pharmacies are facing is even tighter. We know that you have to have a certain type of reimbursement to support the Medicaid programs, and we're also feeling that same crunch from the pharmacies trying to drive their operating margins to be able to stay in business and stay open to the communities that they serve and they frankly are part of in driving your members' care. We know that part of their need is looking to diversify their revenue. They're also looking to say, how can I be more of that pillar of care, part of that care management team for my members, where I know I have the ability to drive better outcomes and drive better holistic care for our members. So we're hearing those needs from the pharmacy from how they're looking to pivot and move their business models forward to have more of that hand in their care. And all this is leading to the emphasis on quality. I know many of you on the phone represent many states across the country, and we know that there are certain quality metrics by states that have to be met. Not only is the state agencies looking for that emphasis on quality, but your members are demanding those quality products as well when they're looking to who they choose as a partner or who they want to maintain their benefits with longer term. We know that quality is being looked at in multiple aspects, from the different disease states that members are in to the outcomes that we are driving and being able to drive with the members for those various disease states. So the emphasis on quality is getting bigger. The pressure on the dollar is getting stronger, and those really just pull us in two opposite directions. So we're at a point where we have to say, how can we meet the needs of all the stakeholders, the plan sponsors, the pharmacies, and the members who are ultimately receiving that care? And that has really driven us to what we're going to discuss in depth here today, but looking at driving more quality out of the pharmacy and the pharmacist to help really deliver for all of those stakeholders. So if we want to jump to the next slide, really just want to anchor ourselves to how we looked at quality historically and how we're looking at quality on the go forward. So I just discussed there are a ton of financial pressures, but that has led us to really stop necessarily anchoring ourselves to the black box you see there of clinical programs to deliver quality, and really looking at the entire experience from the member's journey through their disease treatment and the reception of their prescriptions to look at that quality aspect. So we're looking at it from the aspect of the pharmacy network. What type of services can those pharmacies provide to those members? What type of experience do those members have in those different pharmacies? That leads to the point of sale care. What can happen for that member at that pharmacy when they are receiving their prescription? What type of additional services can the pharmacist render state by state, region by region, to be able to provide a different type of quality outcome with that interaction? All this is anchored on that experience, all focused around how the member is really receiving the services and being able to drive to the outcomes. And we know all of this has to be done with an emphasis on value. We know that there's also an ability to move the dollar from your medical spend to your pharmacy spend and be able to save value. Looking at those lower acuity services, which Adrienne will talk in depth about, but how do we look at what the pharmacist and the pharmacy can provide from that network and that point of sale care to really be able to take those lower triage or lower acuity needs of our members and move them to the pharmacy and that pharmacist, which is a lower cost of care than that medical side. Just a different model from the pharmacy to medical, but still being able to be a service for our members to receive those types of care. And I don't want to jump too far ahead and steal Adrienne's thunder, but as we think through lower acuity services, such as vaccinations, that is a place where there can be savings had and can provide a better outcome for our members when those are accessible at our pharmacies. So I want to jump to the next slide really quick. Really, this is just how we are moving forward to think about that quality of care. So walking through all the elements I just spoke of how we're thinking through and why there's such an emphasis on it, we look to combine all of these aspects into our program that's called MoreThanRx. And this is going beyond the dispensing of the prescription, just as the name entails. So from the MoreThanRx arena, we have really crafted 3 different parts of MoreThanRx that go in to make it one entire program. You're going to hear us talk today about direct pharmacy services. So interactions that the pharmacist can directly do with the adjudication of the claim to provide services for our members, as well as those clinical outcomes-based services, closing gaps in care, focusing on adherence, working on interventions that are near and dear to our Medicaid members, and really even going beyond to any line of business. As we know, many of you also service more than just Medicaid as well. And all this is really influenced by our IndependentRx Initiative that Stephanie is going to talk about in depth, really focusing on our independent pharmacies. They're the backbone of a lot of our communities. All of our independent pharmacists that we work with, they know the individuals that they are serving. They know their kids, they know their families, they're part of the communities that they service, and they are very invested in their community having the appropriate care. So our independent pharmacists have been a real backbone of the programs we have going forward when we think about an emphasis on quality, because they want to do more. They have the ability to do more. They know their populations to be able to provide them that right site of care, that right level of care, and be able to really drive those positive outcomes from the relationships that they have already established with their community and with their customers. So with that, I'm going to let the experts take over here from the meat of the presentation, and I really want to toss it over to Stephanie first to really dive more in depth from the independent pharmacy perspective.
Thank you, Ashley. It's important, I guess, to understand a little bit more about my background so that you understand why I'm talking about independent pharmacy. Most of my career was spent as an independent pharmacy owner. I'm actually a 2nd generation independent pharmacy owner and really grew up in the community pharmacy space. So when I talk about independent pharmacists and the work that they provide in their communities, that's a world that I'm very familiar with and that really speaks to me. I think our independent pharmacies are very good at uniquely responding to the needs of their communities. And so the perspective that I bring to my role at Express Scripts, having 15 years of pharmacy ownership experience, is really the perspective of that independent owner, to try to bridge some of the gaps in communicating the perspective of the independent pharmacist, but then also helping to really build partnerships with a PBM like Express Scripts, and to bring the value of the independent pharmacy and all of the things that they can provide in their communities to what we're building together, and to really make that relationship fruitful and productive to really improve the care of our patients. One of the things that this initiative has been really great at crafting is some of that bidirectional communication, where we can bring the perspective of the independent pharmacy owner to the work that we're doing at Express Scripts, and to really make sure that what we're building is something that will be impactful in the communities that we're able to serve. So certainly been a great time. As I said, I've been here about a year and a half and have learned a ton. Certainly not working at Express Scripts was not something that the average independent pharmacy owner dreams that they'll ever do. So it's been really exciting to learn more and to bring the perspective of the independent pharmacist and to wear that hat. I think especially excited to talk about the Medicaid space, because I think you're going to hear a little bit more in coming slides, but our independent pharmacies certainly do a lot to maintain care for the neediest of our patient population, which is certainly the population that your plans serve. If you want to go to the next slide, that would be super. So as I've alluded to, I think our independent pharmacies are often really our first line of defense in communities. I think we see this more and more, and we saw it during the pandemic, where patients rely on that relationship and that access that they have at their independent community pharmacy. We do know that oftentimes our independent pharmacies are serving patients in areas where there may not be other providers, where chains are not, where there are not always grocers. And so these pharmacies serve a critical need in our networks and in the care of our patient populations. Obviously, patients would know to go receive prescriptions at our independent pharmacies, but didn't always classically think about pharmacies as providing more than that. And again, during the COVID pandemic, we saw a shifting in patient expectation around what could be provided and received at a community pharmacy. And that's been, as a pharmacist, really exciting to see not only the pharmacist perception of what they could provide in their pharmacy grow and change, but seeing the patient expectation of what they could receive in a pharmacy also change. And so that's been a really exciting thing as a pharmacist. We've been talking about that for many years, is, using the pharmacist to practice at the top of their license. And we've seen the COVID pandemic help to accelerate some of that transition. And certainly a lot of what's informed our MoreThanRx product, which you're going to hear Adrian talk more about, has been informed by that shift that we see in the market. So certainly a very exciting time to be a community pharmacist, as much as it's terrifying. At the same time, it's exciting. If you want to advance to the next slide, Allison, thank you. So as I also have alluded to, we have a large number of our patient population that is being serviced. Our needy patient population, our neediest patients, are oftentimes being serviced at our independent pharmacies. And so we know that, in particular, independent pharmacies can respond to patient needs. I constantly think of a story of a pharmacy partner owner that I am a close colleague of, and I remember him talking about how his delivery driver serviced a homeless patient, and he had the certain schedule set with this patient that they would deliver the medications to the patient at this particular underpass on a particular day. And the level of service that was required to meet the needs of that particular patient and the difficult living situation that they were in was something that pharmacy went above and beyond to serve. And I think if we queried any of our independent pharmacies, they would all have a similar story that they could tell us about a time that they cared for a patient that had a really unique need. And so that's, to me, the beauty of an independent pharmacy, is that ability to custom problem solve. And so while it does make it challenging to create processes and scalable opportunities, we have a group of providers that are doing some really unique, amazing things in their communities and addressing health equity in really cool ways. And so part of the role of the IndependentRx Initiative and the office that I'm leading is to try to figure out how we can identify where those things are happening and make sure that we're building things that allow for that care to continue to happen and to make those providers sustainable, to make sure they can continue to provide that unique care in their communities. I think we have a poll question I'd love to ask you as well. So this question, to get you engaged here, I'm wondering if you would vote here for what type of pharmacy provider you think cares for the least vulnerable patient population. So your choices here, you just get to pick one. You can pick grocery stores, chain pharmacies, or independent pharmacies. So take a moment and vote for the pharmacy provider type you think cares for the least vulnerable patient. But that's a pretty quick and easy question. So Eric, if you want to just launch what the answers are, that would be I'd be curious to see here. Okay, so you're all pretty not quite right on, actually. So this is a great question. I'm glad to see this. This actually surprised me when I learned it. And this is actually according to our data. So this is the Evernorth Social Determinants Index that I'm going to reference here. But what we found in looking at our Social Determinants Index is that 57% of our independent pharmacies care for patients with a high social determinant index, while 42% of our chains care for that type of high ESDI patient population, and only 34% of our grocers. So actually our grocers are taking care of the least vulnerable set of patients, and independents are far and away taking care of the most vulnerable set of patients according to our data. So great question. Thank you for your engagement. So that data does serve to kind of inform how we move forward, knowing that our patient population is being serviced more frequently by the independent pharmacies. It's allowing us to look at our providers in unique ways, to consider how we are making sure it's not just every pharmacy treated the same, but how can we make sure that those populations that are being cared for in unique ways, in different ways, that are really where the sickest, most challenging patients are living, how can we make sure we're caring for them in the way that's going to serve their needs and to help manage cost, help improve health, all of those things. So lots of questions that we're asking of our data, trying to think about how do we actually engage these patients in the spaces that they're actually already receiving care, and how do we plug into our providers in different ways. So that's a lot of what we're working through with MoreThanRx that Adrian's going to talk more to you about. If you want to go to the next slide. So as I thought it would also be helpful just to give you a little bit of background on our Express Scripts network and the number of independents we have. Obviously, they're a critical portion of our network. We have about 22,000 independent pharmacies, so they represent a large portion of our pharmacy providers. We've actually seen in our network that the number of pharmacies has increased over the last 5 years. So we do hear a lot about pharmacy closures. That's certainly something we're watching, and it's been a challenge. But in our network pharmacies, we've seen that actually increase over the last 5 years. But as we've alluded to again, is our independent pharmacies, I believe, represent a very big opportunity. I think pharmacies in general are seeing a lot of challenges. Independent pharmacies, obviously reimbursement is a very big challenge for them. That's something that we hear about very often. But I think those providers are also standing ready to move into different ways of caring for the patients that they serve. And so they're oftentimes already engaged in services. They're often already engaged in new ways of providing care, but they're not often always getting paid for that. And so what we're trying to look at is how we can make sure that these services that they're often already providing, or that they're ready to provide, that we can partner with them in ways that make their businesses sustainable and allow them to really efficiently care for the patients that most need it, like we were talking about, those vulnerable patients. So something that is very front of mind for us is how do we look at that? I also mentioned about the COVID pandemic kind of really showing us what pharmacies were capable of doing. And this data, I think, is just really interesting from the CDC, where we see that our local independent pharmacies really responded to the opportunity and the challenge that the pandemic provided. So we saw over 300 million COVID-19 vaccines provided in those pharmacies. They were really able to quickly pivot their business models and operate in ways that allowed lots of patients to get what they needed And same for the COVID testing, right? And I think that's helped to pivot the patient's understanding of what can be received in a pharmacy. And so if we talk about like how one little thing becomes one much bigger thing, I think the COVID pandemic really did accelerate the expectation of the patient and of the pharmacies, and honestly of the whole entire system as far as what a pharmacy would be capable of doing. And then we see, you know, obviously providers being limited in their scope and appointment wait times and just all of the challenges in the primary care space that have just, again, enabled an environment where pharmacies kind of get to step in and say, I can do that. And so that's been a really exciting thing to see and to watch grow and to be part of building for. So you can advance to the next slide, please. So first, I guess I'm going to ask a poll question here. Have you heard of our IndependentRx Initiative? Yes or no? It's an easy, quick question, but I'm just trying to gauge your interest or your current knowledge on our initiative. We'll just give you a few more seconds to vote on that one. Okay, so most of you have not, which means I have a naive audience, which is great. I get to not bore you with what you might have already heard about before. So I will tell you a little bit about it. And honestly, this initiative began in 2023, and really how it started was as a way for Express Scripts to differentiate payment to our rural pharmacies. And so that was kind of how the initiative kicked off in early 2023. And then it continued with the hiring of me in this role, brand new role. This has never been a role that has been part of Express Scripts before. It's really been a role that allows for a lot of cross-functional collaboration across our organization within our Evernorth group and our Cigna group, in addition to within Express Scripts. And I lead the Office of Independent Pharmacy Enablement, which basically enables me and my team to basically serve as subject matter experts around anything that pertains to independent pharmacy. And so we are able to bring the perspective of the independent pharmacist, not only from my lived experience as an independent pharmacy owner, but I also lead a committee of independent pharmacy owners and leaders who basically provide us their opinion, give us feedback, tell us what we're doing good, bad, and ugly. And some of it is ugly. And we listen to them and we engage with them. And that has been a really informative group that has shifted how we think about some of our products and services that we offer, and has enabled us to just have a better finger on the pulse of what's happening in the community pharmacy space. So again, my initiative that we lead here in this whole independent RX endeavor is to try to take what we know is happening in our communities with our independent pharmacy providers and to really be able to continue to build and grow and respond to the needs of those providers so that they continue being able to care for those vulnerable patients that we know that they're already taking care of in higher numbers than our other network providers. So certainly been a great time, been a lot of fun. Learning more about the PBM for myself, leading this committee that's been able to learn a lot about what we're working on as well. And then to have that happen the other direction too, where Express Scripts is able to really better understand the perspective of the independent pharmacy and to really work with those providers to make sure we're building things that are going to actually be something that they can implement in their community pharmacies. So if you want to advance to the next slide. So as I said, this Independent Pharmacy Advisory Committee, what we have done is basically taken our country and divided it into regions and made sure that we had representation from across the country so that every unique spot in our country could in some way be represented. We have people that represent urban areas where they have a very different population than our rural providers, and then everywhere in between. We even have a pharmacy that owns a pharmacy owner that owns a pharmacy on an island in Alaska that's only accessible by ferry. So a really excellent group of providers who are not scared to tell us what they think. And that's been a really big part of my job and how we can continue to represent the viewpoint of the independent pharmacy owner internally. So as I said, a lot of that work and a lot of that feedback has really informed how we build things. And so I'm thrilled to turn it over to Adrienne, where she's going to talk to you a little bit more about the MoreThanRx and how that continues to grow and expand as far as how we enable our pharmacies.
Thanks so much, Stephanie. So as Ashley and Stephanie had alluded to, the healthcare landscape is and has been undergoing a truly seismic shift. Part of that shift is the recognition in all healthcare sectors that the pharmacist is an absolutely critical part in our patient's healthcare team. So from the perspective too of federal and state regulations, we see those regulations and those agencies only continue to enforce the importance of this relationship. So you probably understand that new quality regulations are being released every single day. In fact, a very large piece of regulation was released kind of around the middle to end of last year that required reporting of quality initiatives and metrics in the coming years, starting in 2028, kind of similar to the way that Medicare plans do. So we anticipate that this will have our health plans working more closely with us and also with their local pharmacies to encourage continued provision of services and continued access to care, particularly for those vulnerable members who need it most. And through MoreThanRx, we're really empowering the pharmacist to provide integral care through reimbursements for other services that go beyond dispensing drugs. So if you think about MoreThanRx, definitely think of, as Ashley had said, care at the point of sale, the development of the relationship with the pharmacist, the cultivating of those relationships. And the IndependentRx Initiative is very tightly woven into everything we do from a MoreThanRx perspective. So we want to make sure that any offering that we provide through MoreThanRx also incorporates elements that would continue to support the community pharmacy as well. So since we talked last year, we have continued to expand and grow our MoreThanRx program. And today, what I'll do is walk through a few of the programs that are available now through MoreThanRx, as well as some of our emerging programs. Thank you. So first, let's talk a little bit about medication therapy management. Typically, when people think of medication therapy management, it's in the context of Medicare Part D. However, 26 or more states actually require that Medicaid plans offer an MTM program as well, and that number continues to grow. MTM is really important in that it provides critical counseling to patients who need it on affordability of medications, reducing the risk of adverse events, including hospitalizations, complications, ER visits, optimizing medication use, as well as improving medication adherence. And of course, the implementation of any MTM program can decrease wasteful healthcare spending. Now, many MTM programs now in many states are requiring that MTM programs move more toward providing these services through the retail and independent pharmacy. This provides an opportunity for MTM programs to leverage that relationship between the pharmacist and the patient in order to truly provide solid services that provide better patient outcomes and more affordability and continued access to care. So Express Scripts works very closely with our pharmacies internally, as well as via a vendor. We do work with Outcomes MTM to provide MTM services, but also our long-term goal is to work more closely with our own internal network and pharmacies to continue providing these services to our members who need it most. We can go on to the next slide. Thank you. So one exciting thing about Express Scripts MoreThanRx service is that it does include the pharmacy vaccination program. I know that this is one of those things that has been provided, for several years. In fact, through most vaccine admin programs, we see a really large increase in the administration of vaccines. However, we're really excited to see that between 2023 and 2024, we've seen a 50% increase in the administration of flu and COVID vaccines. This is really important to us because from a company standpoint, we strongly believe in the benefit of vaccines. Of course, from a member perspective, they improve health and outcomes. Of course, they reduce complications from, things like shingles, flu, COVID-19, whether that is from the disease states themselves or other comorbidities. They reduce hospitalizations and, ultimately save lives. Additionally, vaccines are important for children as well, and also in circumstances where maybe you're traveling and you need a vaccine for, a more localized potential contagious disease. So vaccines are a really critical measure as well in quality programs. So if you look at the adult core set and the pediatric core set for HEDIS, both of those do include adult and childhood immunizations. So providing vaccinations through a vaccine program at the pharmacy will improve your quality as well. So another important thing from a vaccine standpoint that Express Scripts does is we do provide these at no additional cost to the member to make sure that members are able to access those vaccines and to reduce any potential barriers to care. We do have a number of vaccines available, from a more acute perspective, COVID-19, Tdap, things of that nature, as well as travel vaccines and childhood vaccines. But now that we know that pharmacies have really sort of taken on the role of, providing vaccinations, and that service is so entrenched within the pharmacy, I'd like to talk a little bit more about what's next. We can switch slides. Awesome, thank you. So from the medication administration program, this is one of our emerging programs. Clients are able to enroll in this now here at Express Scripts. This goes live February 1st. We're really excited because medication administration services at the pharmacy are becoming more and more important, in terms of administering injections for patients like long-acting antipsychotics, antibiotics, contraceptives, hormones, and vitamins. Really providing a solid medication administration program can substantially increase patient quality of care, patient adherence, as well as, of course, medical and prescription savings. The convenience of offering a medication administration program is a large part of what increases the adherence. In addition, sometimes when pharmacists have that patient there at the counter, they'll also talk about, chronic disease states, perhaps for which they're receiving those injections, whether it's vitamins or something else. So that's a really important part of our medication administration, is leveraging that relationship to provide that education. And of course, patients experience greater satisfaction working with their pharmacists to ensure that they continue to receive their care in as convenient a manner as possible. And this is something, as I said, is going to be made available starting February 1st. And we're truly very excited to offer it, and we're going to see our services continue to grow. And next, if you don't mind switching the slide, thank you. I'm going to talk a little bit about some of our consultative services and pharmacist prescribed medication. So this is one of our emerging programs that we are hoping to offer in the next year. So kind of understanding that typically the first place the patient goes when, they do have an illness, maybe they pick up the phone and contact their doctor, but many people go to the pharmacy, whether it's to pick up, cough medicine, a COVID test, or something along those lines, they go to the pharmacy. So it's very important to us that we make it easy for a patient to also get treated. So one of the things that we would like to be doing in the next year is to provide viral therapy at the point of sale. So in circumstances where, a patient feels like they may have been exposed to COVID or flu, being able to get a nasal swab there at the counter and then be prescribed Tamiflu if necessary, or Paxlovid. And of course, accessing oral contraceptives can be a big challenge, needing to call your doctor to get a refill or to be newly initiated to therapy. That's something that we would also like to be able to provide at the point of sale. And of course, smoking cessation, sort of thinking about how smoking has decreased throughout the last few decades. At the same time, there still are quite a few people who do smoke and who are trying to quit. And having those regular touch points with their pharmacist and the pharmacist capable of prescribing those medications, we think will be critically important. Now, one thing that we are keeping a focus on, understanding that consultative services are very important, but at the same time, the pharmacist has to be able to provide them within that state. Express Scripts has been seeing a huge expansion in the prescriptive authority of the pharmacist. It's something we see new regulations coming out, at least on a weekly basis, if not more frequently. But of course, we're continuing to monitor that to ensure that any pharmacy providing those services is fully compliant with federal and state regulations. So that's something that we are going to continue to monitor throughout the years as we see prescriptive authority expand. Can we go to the next slide? Thank you. So one of the questions that we've received pretty frequently over the last few months is, okay, how many pharmacies are in your network? You can provide these services, but how many pharmacies actually provide them? From a vaccine perspective, almost 61,000 of our contracted stores provide these services. Now that's a mix of retail and independent, as is our medication administration and consultation network, which has more than 5,200 pharmacies contracted. It's something that we're very, very excited about. And as Stephanie had talked about earlier, we're really looking to work closely with our independent pharmacies as well, our smaller community pharmacies, because in many circumstances, some of these services are things that they already provide, and we want to make sure that they can continue to provide them through, reimbursement throughout the years. We can go to the next slide. So this is really just a snapshot of all the MoreThanRx services that we offer. I'm not going to make you listen to me read them to you, but suffice to say the lighter green services are services that are in the process of being enhanced or more emerging services, whereas the darker green are services that we already actively offer today. So we're really excited to provide these services. We strongly believe that making care more accessible will serve the more vulnerable populations, the most vulnerable among us who truly need those services. And we really hope to work with this group in the future. We're really excited to be here and looking forward to providing more. And I'm going to kick it over to Ashley for our questions.
All right. Thank you so much, Stephanie and Adrian. Really appreciate you walking through in depth the independent pharmacy perspective, and then also really walking through the full breadth of services that we are looking to provide from our pharmacy networks to enable our members to really receive more care from that community pharmacist. So please, if you have questions, submit them through the chat. I will start going through them. And Stephanie and Adrian, I will just direct them to you and I'll read them off so the group can see them. We just have a couple right now, but we will wait for a few more to come through. While we're doing that, I think there was one last poll question as I pull these up. Eric, do you want to launch that last poll question? This is just really going through everything Adrian and Stephanie talked about. And we want to ask any additional questions here, and you can select multiple choice. What additional kinds of services would we consider or should we consider adding to the MoreThanRx program? So things that your members are interested in, things that you as a plan are interested in or as a sponsor. Please select the multiple answers that you think would be important to see our community pharmacists doing for your members. We'll give you just a moment there. Oh, we got a few more questions. This will be great. All right, Eric, do you want to flip to the answers? Fantastic. So I think we got a lot of good responses here. So Virtual consultations is definitely one we're talking about as a team as well, seeing that as a need. Also, test to treat, very big, along with the rapid testing at the pharmacy, at home vaccines, and some over-the-counter supplement consultation pieces as well. So thank you for that. This is really important. As we grow this product and then go forward, we really want to make sure that it is servicing the needs of all of the various lines of business, especially our Medicaid members, where we know they will benefit from the access to the pharmacist at their community locations. So definitely thank you for that insight as we proceed forward to advance our program. All right, so I'm going to start going through the question. Stephanie, the first question here is for you. And so the first one is specifically on independent pharmacies. So when you're talking about the health equity work, the question came in saying, how are the independent pharmacies, able to get paid for addressing health equity? How would an independent pharmacy try to submit this information to us? And talking about how medical providers have Z codes that they use to get paid, but how do we think about pharmacies as getting paid for these types of services?
That's a great question, because it's many of the items that we actually are working through and wrestling with and trying to navigate to figure out. So I think probably most importantly first is how independent pharmacies are getting paid. I think first it's oftentimes they have these relationships with these patients, and anytime there is an opportunity to care differently for one of those patients, and potentially a payment opportunity, that is something the pharmacy is able to take advantage of. Of course, identifying gaps in care like needs for immunizations and other services. There are some easy things that are already able to be addressed by an independent pharmacy, but then we see that as a growth area where there are a lot of different ways that pharmacies are getting paid to care for patients that do have social vulnerabilities, but certainly is a lot of opportunity there and a lot of ways that there's, I think a need for enhanced ability to pay those providers for things they provide, like delivery, medication packaging, medication synchronization, vaccination gap closure, medication therapy management. Certainly some of those are things that are easily reimbursable, and some of them are things that there's a lot of opportunity to improve how we do that. To your question about how those things are billable, I think it all, of course, depends on whether that's something that can be billed through the pharmacy NCPDP format, or if it's something that has to be captured in a different type of format. And that's exactly the sort of thing that we're working on every day. I think Adrian would agree that this is the sort of thing that we work a lot on, trying to make sure that we can have those providers properly document the services they provide, knowing that there's things that are easy to document already within the normal pharmacy workflow, and then other things that are a little bit more complex that require a different level of effort. So certainly a lot of things in play that we're working on to solve with those pharmacy providers' feedback to make sure that that's something we'll be able to capture. Thanks for the question.
Yeah. And so Dan, I want to double click on, we're really working to make sure that it works with their workflow. And we know they have such a variety of platforms. There are some ways that many pharmacies have an integrated way to submit to health plans and PBMs today. And it's really just working on what's that more, I would say, a universal way to capture that information from them, because we know it is valuable for our health plans, especially when you have to report it back for certain metrics in Medicaid or Medicare, or just even looking to aggregate it for some downstream entities if you're even in the commercial space. So definitely looking for ways that we can do that. And we will provide that detail to our clients as we move forward as well on how we can capture the information they are most interested in to receive, and how and the elements that they need so they can submit it as necessary. Okay, I'm going to start scrolling through. A couple have rolled in here, so bear with me, everyone, as I kind of aggregate. There's a question that had come in while we were talking about data that we were citing. I think this was in Stephanie's section, talking a lot about the Health Equity Index and do we deem it generalizable to the population? So Stephanie, I'll take a stab at this, and then any other insight that you would like to add. So when we look at our data across our Health Equity Index, we are really looking at our full book of business. So based on just the membership that we have kind of coast to coast in all the various population segments and all the different age ranges, it is fairly generalizable to the specific population. If you are one of our clients or we work with you into the future, we can drill down into your specific type of populations and find pockets where you may have some anomalies or may have something that is more prevalent in your specific area. But what Stephanie speaks to is generalizable to the general population, just based on the membership that we do include in those type of analyses. Stephanie, anything else you'd want to add there?
Yeah, the only thing I would add is that the ESDI, the Evernorth Social Determinants Index that our team queries and pulls data on is very similar to the CDC available data. It's just from my understanding, and I certainly can get in over my head really quickly, but the team that has pulled that data it speaks to it as though it's just a bit more comprehensive of a look than the CDC data around social determinants, but very much, I would say, similarly generalizable across the population. So maybe, I'm not sure if Ashley's audio cut off, but if maybe,
Oh, I'm so sorry.
oh, that's
Can you hear
okay.
me now?
We can.
I am talking away. I apologize greatly. The next question I was saying, Adrian, I'm coming to you for it. And so this is from asking if there are specific criteria to be enrolled in the administration and the consultative work that you spoke of. I'm not sure if this is from the pharmacy perspective or the health plan perspective, but could you touch on it from either perspective really quickly?
Yeah, absolutely. So from a client perspective, if a health plan is seeking to enroll in the More Than Rx program, particularly the med admin and consultative network, we would expect that, you know, the health plan would work closely with their account team to enroll. From a pharmacy perspective, of course, we would work with each pharmacy individually if needed to ensure that, you know, all criteria were met. But, you know, it's really, you know, up to the pharmacy if they choose to enroll.
All right, Adrian, thank you for that. If you have rolled in, so bear with me for a moment as I am just scrolling through these. All right. So we are getting a question here. It says, since the launch of the Independent RX program, so definitely this is probably more in your arena, have there been any improvements to pharmacy access for the rural populations? How do we think about the independent pharmacies and the support from the Independent RX programs that have been set up?
Yeah, so as I mentioned, you know, the Independent RX Initiative is really a strategy. So there's a lot involved in that initiative and a lot that's continuing to be developed and enhanced. But the initial way that that program launched was to identify those independent pharmacies that are contract with us that are more than 10 miles away from the closest pharmacy to them. And so those providers were offered enhanced rates early in 2023. So those, you know, it's roughly, I believe, around 900 pharmacies that are already seeing the benefits of at least that rate enhancement. But this More Than Rx is another way that we're trying to make sure our providers engaged with that, because that's, again, when we talk about pivoting to allowing pharmacies then to also see reimbursement for service-based items, is really where we see the More Than Rx step into that. So that's something that all of our pharmacies are eligible for. I think we'll see a lot of opportunities, especially in our independent pharmacies where they are in areas where there may not be other providers. And that continues to be an area where we are looking at those pharmacies. How can we make sure those most vulnerable pharmacies, the pharmacy deserts, the places that are at risk of closing and there would be a big patient gap and a big need, how do we continue to identify those pharmacies and make sure they are getting what they need to remain sustainable and viable? And that's, you know, that's a lot of what we're looking at. So some parts of it, we've seen outcomes, but we continue every day to try to build things that will better enable those providers to remain sustainable. And then certainly looking a lot at the data, what does the data tell us and what do we need to do with it? That's certainly a very big part of this initiative, is making sure that we're continuing to make sure we're looking at all the information, measuring outcomes, looking at all of that in ways that we never have before. So certainly a lot to come on that.
Fantastic. So I think there's a couple in the independent space, so we're going to stay here for a minute and just kind of tag team them all. So the next one comes in, which I think is a really great question. Is there an opportunity in the future to connect our independent RX initiatives to government agencies like the Indian Health Service pharmacies? Have we ever thought about working with those any differently from your perspective?
I think that's a great question. And I love that idea because I think there is a lot of opportunity with government programs. I think we obviously see that being an area where the government, I think, has done a really good job of being very forward thinking. And so I haven't specifically thought about Indian Health Services, but I love the question, and I'd love to kind of maybe offline connect with the person that submitted that just to understand that one a little bit better. But we do think about that even with the armed services and, our TRICARE program, and are there ways that we can use our independent pharmacies to provide access in areas where we have service members. So I think there is definitely a lot of ideas kind of in flow around how do we use our independent pharmacies to help government programs such as something in the Coast Guard, for example, or other things. So really curious about your question. I think that's a great one. I'd be really curious to learn a little bit more about what you're thinking there.
No, I completely agree. If someone would have reached out that was anonymous, but if there is someone that would provide their information, love to connect with you about the Indian Health Services. I think what it gets to is there's definitely different types of pharmacies serving different types of populations, different vulnerable types of populations. And that's what we're really looking to provide, is that type of care to those members in that setting where they are most comfortable, where they are being serviced today, and really bringing care to them. So thinking and expanding our independent program to other types of pharmacies that do service different types of populations, I think is exactly where we'd like to head into the future. All right, Steph, I think we have another one here in the independent space. So they're talking about the stats of the vulnerable patients using the independent pharmacies. Going back to your poll question, I think they got quite the mixed answers, which was fantastic. Are there themes that we are seeing of why patients are choosing independent pharmacies over the larger chain pharmacies, or even from a home delivery pharmacy?
Yeah, great question. And some of this will be based off of my own personal experience, not necessarily data. So I will caveat my answer with that. But I think we generally see that the patients that most need the care are going to go to the place that they receive it. So that sounds really kind of basic, but I think what I'm getting at is if you are homebound, or you are elderly, or you need assistance with your medications, you're going to go to the provider that's going to be able to provide that to you. So for example, oftentimes our Medicaid patient population who might have higher needs is more likely to go to the pharmacy that's already offering some services that would benefit that patient population. Versus, I think we can speak to the grocers being potentially a lower patient vulnerability index, patient population that they service, because typically, if you're going to the grocery store for your medications, it's just because you want something that's fast, easy, you don't have to go out of your way. It's convenience, right? So you're not necessarily that patient that needs all of the special services. So I want to say that the services an independent provides tend to self-select the patient that would need them. So that, I even think of patients that I serviced in my pharmacy. I did things that nobody else offered in the community. And that is very commonly what an independent does. They look at their community, they see what services are not being provided, and they plug in to those services. And so for me, it was even okay, the blind patients that didn't have the access to Braille labels, they were coming to my pharmacy because they never left their home, and they needed to have the medications labeled in such a way that they could tell what they were. And we would, if we had to change a manufacturer, we had to indicate that somehow specially on the bottle. That's not probably something our partners at a chain pharmacy would have the capacity or maybe be freed up by their management to provide. And that's something that's very commonly done in an independent, where they can say, yes, you have a special problem, I have a special solution, and the team that I'm working with has the capability and freedom to solve your problem. And so again, even that patient story of where the patient was homeless and they needed deliveries to an underpass, that's the independent pharmacy, right? Like a Spanish speaking population. I can speak to a pharmacy that has a pharmacy on the border. Their pharmacy is almost 100% Spanish speaking. You can guarantee every staff member at that pharmacy speaks Spanish, right? So that's the beauty of an independent pharmacy. So oftentimes the community helps to self-select the population that is served by the customer service and the experience that pharmacy is providing. And it's because those owners and the staff members live in that community. They understand the needs of the community. And so they're capable of building the services that community requires, which is obviously a little bit different than the model of our chain partners, where it's a little bit more standardized. So I sometimes call independent pharmacy the Wild West, because it's in its beauty, it's really great at customizing solutions for a specific area. But what works in downtown New York City is very different than what might work in rural Texas, which is very different than what might work in suburban Chicago. So that's the beauty, but also then the challenge. And part of what just really excites me about the work that I do is that I get to basically try to create something magical out of the chaos and Wild West that is independent pharmacy, but knowing that it really has the ability to support these patients in ways that they really need, that they really can be critical.
Stephanie did a fantastic job describing it. I think it just comes down to they know their populations, they know the community, they service them in very unique ways. They have that agility to be able to meet the needs. The different languages you spoke of, for example, servicing very different populations, like the blind one that you spoke of too. I just think they do magical things. I love the way that you described it because they do service their populations in a very unique way, just because they have the ability to move quickly and be able to individualize their patients and the need for care, which is why I think they have been such great partners of what we had showed from those numbers for who wants to provide and who is able to provide the care that we are looking to bring from the pharmacy side to the members. All right, so we have one more coming in here as well. Oh, I'm sorry, two more coming in here, but the first one is, are these services mostly paid through pharmacy claims? So yes, so as we think through the MoreThanRx program, really it is to move all of it to the pharmacy side. So if it's a fee that is added on to the adjudicated claim from the actual drug reimbursement itself, that is a pathway in which the service is paid. If it is just transaction-based, where we are looking into the future of what Adrian was showing, or the test to treat, which even many of you said would be an area to go to, we are working with our pharmacies to be able to have just a mechanism to bill just the service if a medication is not rendered as part of that service as well. So those service fees are a little different on adjudication and adjudicating it with a claim from NCPDP format, but that is something we're working with our pharmacy network and our pharmacy community on to be able to ensure the services can be documented, provided back to our plans, and be able to be reimbursed to our pharmacies as well. All right, and I see one more coming through here as well. What outcomes are we measuring and what are the results for the established programs? So Adrian, I'm going to come to you just to talk about this one a little bit. If we think through the programs that are established today, our MTM programs, our vaccination programs, can you talk a little bit about how we look at the utility of those programs or the utilization of those programs from our members and our pharmacies?
Yep, absolutely. And that's a really great question. So a lot of it is dependent upon the program that's provided. So for example, from an MTM perspective, your state might be looking for a certain percentage completion rate of comprehensive medication reviews. But in addition to, looking at that percentage completion rate from an ESI perspective, we would also, at Express Scripts be looking at things like, are we seeing improvements in adherence rates? Are we seeing, improved PDC or, other quality metrics? Looking at vaccine administration, for example, we might be evaluating, what number of vaccine, uptake we've been seeing, what percentage have we been seeing increasing. So, it really varies by program, but of course, overall, we do try to specialize the metrics that we're looking at by program to make sure that we're measuring specific outcomes at that program, but also at a population level. So in some circumstances, you might see us evaluating diabetes metrics, and then also comparing that against cardiovascular metrics within the HEDIS core set. So I guess that's a really, really long-winded of saying that a lot of it is dependent on programs, and we try to look at the data from a variety of slices as well as holistically to truly understand the impact that our programs have.
Really appreciate that, Adrian. And so I know we are running right up against time. I know there are a couple of questions that have come in here. We are happy to have any offline conversations as well. If someone wants to submit that to us, we are happy to reach out to you. I think the last few I have are anonymous, so I apologize. I don't know who they are, but if there's something that you'd like to discuss we did not get to today, we are happy to connect with you offline as well. Eric, I will toss it back over to you just to close us out.
Absolutely. I just want to thank the entire Express Scripts team and Ashley, Stephanie, and Adrian for sharing their expertise and all the information about Express Scripts Independent RX and MoreThanRx programs and how they work to address care and close care gaps with our most vulnerable populations. Echoing Ashley, I want to remind you that today's session was recorded. So if you ever want to revisit any of the great content they shared, you can find the recording on MHPA's YouTube channel. Also, if you want to reach out to me as well, I would be happy to connect you with the Express Scripts team if that's an easier avenue to go ahead and connect with them to discuss anything they talked about or answer any other questions that you may have. Finally, I want to thank everybody for their participation today. This was a really lively session across all of the polls and all of the questions that we received. So thank you for your engagement. With that, we'll go ahead and close out this afternoon session, and I hope everyone has a great rest of your day.
Thank you so much.